But you answered my next question, which was, is the hormones, the bioidentical hormones, are individualized?
Very much so. Very much so individualized. That's the beauty of this, is anything that we compound can be individualized for anybody. You know, so if a patient doesn't really want to put something on their skin, if they work as a lifeguard, or, you know, in different types of situations where they don't want to apply the cream because they're going to sweat it out, or they're a trainer in a gym, that sort of thing, then we can do a sublingual. Granted, you need to dose it more when you do a sublingually, because topically you can do it once a day, because the skin acts like a depot effect. But yeah, we do different things for different people. You know, in the sublinguals, you flavor it whatever flavor they want. You know, so you know everything is individualized at this pharmacy. Nothing is really off of the shelf.
So when you say individualized, is the amounts, the percentage is different to everybody else also?
The percentage, the amount, the route of administration. Yeah, when I do hormone consults, we take into account the person's blood levels or saliva levels, their height, their weight, their symptoms, all that go into dosing.
Okay. How I get started on the bioidentical hormones?
Well, there's a few ways. I mean, granted, calling your local compounding pharmacy is probably a great way, because we deal with so many local practitioners that wherever they are in the country, you know, if I have somebody who calls me from Illinois, which we don't have a license in, I just I go out on PCCA's website, that's Professional Compounding Centers of America, or I go to IACP, International Academy of Compounding Pharmacies website, and they have a thing, find a compounder. And then you can call them. The other option is to go to A4M's website, A4M, and find a practitioner, and they're normally a little bit more progressive in their prescribing. So, you know, because not every single OBGYN is going to do this.
Okay, but do you have to have any particular test before?
Sorry. Some doctors will start it empirically without doing any baseline. I prefer to have a baseline labs done so that we know what we're dealing with. Yeah. You know, because like I said, traditional OBGYNs would go just based on symptoms and say, here you go, here's your prescription. Well, with bioidenticals, we have the ability to monitor blood levels. So why not get a baseline so we see what we're doing, and then start them on a regimen which has to be prescribed by a physician. It can't be done by a doctor of pharmacy such as myself. So we have to find you a doctor. And then once you've started on your regimen, no sooner than 6 weeks will we redo the levels, because it takes at least 6 weeks for everything to even out. So you can. Most people will test 6 to 8 weeks later, and it's the same thing for a thyroid.
Well, what are the reasons why the hormones could be imbalanced?
Well, it's called aging. It's called aging.
Some young people also has hormone problems.
Well, some do.
People with a lot of pimples and losing hair very young, very fat also.
Okay, well, that's the pituitary and the hypothalamus. That's the inner workings of the brain, which are the endocrine system it starts in the brain and it works its way down, and so the messengers can be altered. You know, so then when you've got that's why we use growth hormone in kids that aren't growing enough, because their brain, their hypothalamus, isn't releasing enough growth hormone. So the whole point is, yes, there are always going to be people who have problems with the functioning of the pituitary and the hypothalamus, but at the same time, as you age, all of it starts to slow down anyway. And so, just like a man in his mid-20s has a testosterone level usually between 800 and 1200. by the time you start to hit 40, it can go down as low as 200-300. So that's why there is an andropause. There is such a thing as an andropause, as well as menopause. So
it's better to start it in the early age, like in the late 40s, to start doing the hormone replacement in order to control all of these downs, up and downs.
correct. Normally, what a lot of people are saying is that you should start hormone replacement therapy at least within 5 years of menopause. So anytime after that, there's studies to show that it does increase the side effects, whether that be the dementia or the cancers. But
the depression also helps a lot. I have
right. Well,
a lot of people have been asking me about depression and the bioidentical hormones, and I didn't know.
Well, that's the whole thing. You know, the hormones help with mood. They help with facial. They help with your skin. They help with your mind and your libido. You know, sexual activity. They control a lot of things.
Controls a lot.
They control a lot of things. So it is very important to replace them. And then even if you come in later in life, start low and stay monitored. You know, you're always having your pap smears and your mammograms or some sort of breast exam. That's really all you need to do. I mean, I had a gentleman today, he was 90 years old, called to say that he had just run out of his testosterone cream and needed a refill. You know, so I mean, that's the way it's going these days. Is people want to stay younger, longer.
So more people are lean to be in the bioidentical hormones than before. Yes, more people.
Correct. I've seen a large increase in the last 10 years since we opened.
Yeah. The last question on this first part is, I'm allergic to gluten, and a lot of people have been asking me if the bioidentical hormones are gluten-free or yes.
Okay, and yes, they are. That's one thing that we do a lot of, and because a lot of compounders actually compound for autism as well. And most autistic kids need gluten-free, casein-free diets. So therefore, all of their capsules and everything else, they're basically made with methyl cellulose, with different types of cellulose, because we use 2 different types of cellulose. One acts as a binder that once it gets into the gut, it basically forms a ball type thing, and it causes it to be sustained release. So that's what we do with the progesterone. But yeah, no, there is nothing, everything in this pharmacy is gluten-free and casein-free.